set of special tests for the wrist and hand fingers include the first one is going to be a scaphoid shear test. For this one, we're going to grip the patient's thumb with our hand and then support the rest of the thumb, and we're going to be applying a longitudinal force along the scaphoid bone. If there's increased pain or discomfort in the anatomical snuff box, then that would indicate a positive sign for a fractured scaphoid. The other thing is it's called a shuck test. For this one, we're going to hold the distal radius and ulna bone, and what we're going to be doing is just doing a glide for these anterior and posterior glide. And if that increases pain or movement, that's a positive sign for distal radial ulnar instability. The next test is called the Murphy sign. The Murphy sign. This one is for lunate dislocation. What I'm going to ask the patient to do is to make a fist with his hand, and what I'm looking for is to see if his third knuckle is higher than the rest of the knuckles. That would be normal. If it were lower, caused by his lunate dislocating, so all of his knuckles would be level, that would be a positive Murphy sign for a lunate dislocation. The next one is called an Allen test. For this one, we're going to have the patient make a fist several times and then keep it closed. While he has it closed, I'm going to palpate with my thumbs his radial and ulnar arteries. And then once I have that, I'm going to ask him to open up his wrist. And you notice that it's white. And then I'm going to watch the blood return. Here I release the ulnar artery and skin turns red. And then if I release the radial artery, the normal would be it returns to pink reddish color. If it does not, then that would be a positive sign for some kind of damage to the radial or ulnar arteries. And then the last one that we're going to do is called a capillary refill. And for this one, we can do this to any of our nails, either our fingers or our toes. For this one, all I'm going to do is I'm going to, on top of the nail, I'm going to press the top of the nail down. And when I let go, notice it turns white. And then as I let go, it should turn pink while in the amount of time that it takes me to say the word capillary. So I'm going to release it and say capillary, and it should be pink. So if it doesn't return to the pink color, then that would again be a indication that he does not have circulation to that digit. That's it.